Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Let's turn to the question of whether to rebiopsy. And I would say that at this point in November of 2019, there isn't a clear standard of care indication to repeat a biopsy in someone who's progressing on Tagrisso. If they started on at first line, you're not looking for T790M, but there's potentially things to find. Do you definitely favor doing a repeat biopsy? And particularly if there's a patient who's not in an academic center, who's out in the world and may not have access to clinical trials, what is the role of a repeat biopsy and what is the yield of that for progressing disease?
Great question. Obviously, we're going to be looking at it from the standpoint of academics, where we might be able to do something differently based on that information because we might have a clinical trial. So, Of course, we encourage it. We will sometimes try the blood-based liquid biopsies to see if we can find evidence of another mutation in EGFR, such as the C797S, or whether we're going to find something in MET or maybe a bypass pathway. So there's reports of BRAF mutations and ALK translocations. These things can be seen. So we'll be tempted to do that. Is it absolutely the standard of care, especially in the community? No, because for most patients, the next step will be chemotherapy. But when we have trials, we think about it. And again, it gets back to that idea of, well, having more information is usually good. But if it is a risk to the patient to do the biopsy, or if it's a risk financially, then you have to really think about that more difficultly. So.
I absolutely agree with all of those points, and particularly, in rebiopsying, I have certainly found things that are targetable that in an off-label way outside of clinical trial, I have also combined Tagrisso osimertinib with other drugs. I would also add that one of the mechanisms of resistance against Tagrisso osimertinib is transformation of non-small cell to small cell. And that occurs upwards of 10% of the time, and that is treated differently. And so it is really important to know that you're dealing with that. And in clinic, I've definitely seen that, and I've also seen transformation of adenocarcinoma to squamous cell carcinoma as well. And so if we're going to be considering a switch to a chemotherapy regimen, those are really informative pieces of information to have.
I think this fits in the scenario of, if you're not looking, you don't know what you're going to find. And we haven't done that much looking to characterize all of the things that can happen with the evolutionary selective pressure of a cancer progressing on Tagrisso. So all of the molecular effects, and absolutely, importantly, small cell transformation, which, as you mentioned, can occur in 5, 10, 15% of cases, is not something we're going to pick up from a blood test either. That's a tissue test.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly, Novartis, and Takeda. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.